gotta have the top set an inch or inch and a half above the iliac crest, right? Your central ray says that it should be in between the ASIS and the pubic symphysis. Okay? But like I said, as long as you have the top of the cassette an inch and a half above. Guys, you're going to keep your feet flat.
Move, Danny. He said don't put your stuff there.
Get him no wig-wag, right? So remember, the femoral necks sit 15 to 20 degrees posterior to the hip, okay, to the pelvis. So we have to invert. And it says to keep about 10 to 12 inches in between this. Okay, so 15 to 20, internally rotate the feet. With the arms. Just cross them over. That's fine. Okay, just feel that crest is right here. Okay, we have 17 by 14.
I already told you.
Mid-sagittal plane is going to be in the middle. You do want to shield.
You're so mean.
Okay. So just like that, 17 by 14, because that inch and a half above the iliac crest. The central ray itself is going to be in between the ASIS and the pubic symphysis. So right there. Okay. So AP unilateral hip. Unilateral was unilateral. Unilateral.
Only one side?
One side, right? So again, if you're doing film screen, you want this away, so do his right leg. So his foot's still inverted. You still want the foot inverted on this. So it's right here. So everybody, you guys already know how to palpate the greater trochanter, right?
Yeah.
Everyone? Okay, so you go right there. Pretty much what you can do is follow the femur. Should be about right there. Medial. Okay. 10.
Unilateral?
10 by 12. Okay. Try to get that soft tissue in there. Okay. So it's 10 by 12. Huh? Then for my lateral, I'm gonna go crosswise. Okay. So you're gonna have a 12 by 10. What you're gonna do is I'm gonna scoot over a little to your left. Okay. You're gonna bend your knee all the way. Okay, and then just go like that. Okay, again, right here is where it's going to be done. Okay, sometimes you have to get a sponge and move them. Okay, but they can do this perfect. Okay, so that's the lateral. Okay, go and lay it down in the middle again. Put this one down.
What did you collimate for the lateral?
Scoot over towards me. So guys, just how we did the oblique lumbar. Go ahead and scoot over. By this. Okay. But remember, only 25 to 30, right?
30 to 35.
No, that's the AP axis.
Oh, my bad.
Okay, turn me back. You do want to keep this straight. Makes it easier. Okay, so you got about 25, 30 there. ASIS. Okay, we have 1 inch medial. Okay, collimate to 8 by 12. Okay, so which SI joint are we looking at, Lou?
No, right.
Right. So in an LPO, we're looking at the upside. If I was in a PA, we're looking at the downside.
Oh, hi.
Okay, so lay on your back again. 2 inches above the pubic symphysis.
Yeah.
Okay.
2 inches?
10 by 12, collimate just a little bit less. Just because we have that, you know, elongation.
That for elongation, not for elongation. What? Don't make fun of me.
Wait, is that an 8 by 10 too?
Nope, 10 by 12. Okay, so 10 by 12.
They're all facing down then from down?
Yeah. Get it towards, we're looking at that side joints in the upper middle, so we wanna, the lower is clear.
Oh.
Okay,
We also
so,
took the x-rays the other way around.
it's fine. Either way, as long as it's out of the way.
No.
Like I said, when you guys do digital, you're not gonna have that.
Yeah, doesn't matter.
Okay, so 35, 30 up, 2 inch and a half above the pubic symphysis.
Inch and a half above, you said 2 inches.
Did I say 2 inches?
I said 2 inches.
1.5 to 2 inches. That's fine.
Somewhere around there.
Yeah.
What is that, a 10 by 12 iron?
Yeah,
Yeah.
I'll 10 by 12. I believe it says 1.5 inches above in your book, but I've read other books, it says 2 inches.